Hi everyone, and welcome to our webinar on selecting healthier furniture, carpet, and flooring. I see some folks are entering now, and so we'll just wait a couple minutes for more folks to join us. We're really excited to have you all with us today. I just gave my dog a bone to keep him quiet, but now it's really loud in the background, so apologies if you're hearing that noise. And we'll just wait another minute or two for more folks to join. While folks are joining, feel free to type in the chat your name and where you're joining from. And also if you can hear me. Hey, Linda from Montreal. Great, we've got, oh, now it's moving quickly.
Hi,
Deborah from Seattle.
Jennifer.
Jennifer from LA. Naomi from San Mateo County. Christina from Albany. Oh, it's moving so fast I can't read them all. But thanks everyone for saying hi. It's great, great to see you all. It's always nice to see where people are joining from. And I think we'll go ahead and get started. Well, I still see a few people joining, but I think we can go ahead and get started. So this is Sarah, and I'm gonna be kicking us off today. I'm with the Center for Environmental Health, and I'm here with my colleagues Judy Levin, also from CEH, and Jean Hansen from HGR. The session is being recorded, so you'll get a link to the recording and a follow-up email, and the recording and the slides and the resources will be posted online afterward. So we're gonna start with the presentation, and then we should have plenty of time for questions at the end. If you have questions during the presentation, you can go ahead and put them in the Q&A box. We're not gonna take them to the end, but that's where we're gonna read them from. So please don't put your questions in the chat because we might have a hard time finding them, but if they're in the Q&A box, that'll make it easier for us to find them and answer them. Okay, so the first thing we wanted to do is just a quick poll to find out who is in the room. So we've got 3 different questions, and they're for 3 different audience types. So if you're a purchaser or work for an organization that is, if you're here because you're interested in purchasing healthier, safer products, please answer number 1. If you are a furniture manufacturer, please answer number 2. And if you are a manufacturer of carpet and or flooring, please answer number 3. And if you have overlap across those, feel free to answer more than 1. So we'll just take a minute and as people vote. Does everybody see the poll? Great. And if this question does not apply to you in any way, you can put a little note in the chat about why you're here or whether or not you are selecting or producing products with
Someone said their submit button is not working.
The submit button isn't working?
Yeah. That is working for others, or?
Yeah, it looks like it's working for others. We're already getting some numbers in. So I'm not sure.
It's only letting them submit if they fill out all the numbers, number 1, 2, and 3.
Oh, sorry. Okay, I didn't know that that would be the case.
Well, we can skip that maybe.
Yeah, sorry about that, folks. I didn't think they were all required. Well, if you want to just yeah, we'll just go ahead and end the poll. Well, maybe we'll ask you all in a follow-up email, but thanks to those of you who are able to take it. Okay. All right, well, we'll just move on. Okay, wanted to introduce Jean and HDR. HDR is a global leader in multidisciplinary integrated design with a longstanding commitment to design excellence and superior client service. Their team of talented professionals is world-renowned for award-winning designs of healthcare, civic, justice, science and technology, higher education, and corporate facilities. Gina Hansen is the interiors manager for HDR Architecture's Sustainable Design Solutions team and firm globally. She's based in San Francisco, California, and has over 30 years of experience in interior design, planning, and sustainable design. Jean is responsible for advancing HDR's sustainability initiatives and project and research work for healthcare, commercial, and institutional environments. So really excited to have Jean with us today. And Judy and I are with the Center for Environmental Health, which is a nonprofit organization dedicated to protecting the public from exposure to toxic chemicals. One of the ways that we do this is by partnering with large purchasers from government, private business, higher education, and designers and architects, and others like you all to leverage your significant buying power and use your purchasing dollars to incentivize manufacturers to move markets to produce more environmentally preferable products. And at CEH right now, the product categories that we focus on are carpet and flooring and furniture, which we're going to be talking about today. And then we also work on single-use and reusable foodware. So feel free to visit our website to learn more about the foodware work, and we can also connect you with that. So a quick note on why we do this work and why we work on these product categories. We know that EPA estimates that most Americans spend up to 90% of their time indoors. And a lot of this time is maybe spent normally in an office environment. Right now, many of us are not in offices and may be spending more than 90% of our time inside. In our homes or in other spaces. And whether we're at home or in the office or another type of setting, indoor air quality is really important because it has been found to impact our health, our comfort, our well-being, our productivity, and just our general health. So studies conducted by the US EPA and others show that indoor environments sometimes can have levels of pollutants that are actually up to 5 times worse than outdoor air. A recent study from Harvard assessed the differences in cognitive function in 3 different indoor environments, and it was very telling what they found. So this slide looks a little bit busy at first, but what it's showing is that basically there were 3 different settings in the study. A conventional setting, which had typical levels of VOCs and ventilation, a green setting that had reduced VOCs, and then the enhanced green setting, which had reduced VOCs and increased ventilation. And you can see how much better participants performed in different cognitive areas across these 3 different settings. And so some of the ones that are most telling are information usage. You can see how low the cognitive scores were on the conventional days and how high it was on enhanced. And then breadth of approach and strategy, also big differences. Crisis response, big differences. So this is really important that we're thinking about how our air quality and our VOCs or volatile organic compounds might be affecting cognition. So most people assume, or many people assume, that if a chemical is on the market, that someone has checked to make sure that it is safe. And this is unfortunately just not the case. There are over 82,000 chemicals in commerce, and 62,000 of them have been grandfathered in 1976 when the Toxic Substances Control Act was first passed. and no health data was received on these chemicals. And of the new chemicals that have come to market since TSCA was first passed, 85% have lacked health data to assess the safety of the chemicals, and 67% have no data on health or environmental impacts. Under the current law, which was updated just a few years ago, the burden of proof is on EPA to show that a chemical may be harmful, and most often the agency has no data to assess safety. There are ongoing efforts to change the law to give EPA more authority, and we're thankful to all of those who have been playing an advocacy role in doing that. But over 40,000 chemicals in commerce, we don't know, you know, whether they're safe or not. So I'm going to turn it over to Judy to talk about how chemicals are sometimes regulated.
Hi, we call this the chemical whack-a-mole game, and I'm going to take you back to the 1970s when kids' pajamas first had chlorinated tris, flame retardants in them. And what we found was, Sarah, would you press the slide? That it was a mutagen and it could change our DNA, and it's kind of a precancerous thing. So the industry, the flame retardant industry said, okay, chlorinated tris is no longer good. Let's find a replacement. Okay, let's go to brominated tris, which is a chemical cousin with many of the same problems, including being a mutagen. So Sarah? Okay, so then many years later, we found that chlorinated tris, wait, that's the one that was in kids' pajamas. Well, it's now in our furniture. And again, it's toxic. So what did the industry do? Now, Sarah, you can blank out chlorinated tris. They switched to a chemical called penta-BDE, which is a halogenated substance that's very persistent and has a number of health issues. So then they switched. What did they go to? Another chemical cousin, Firemaster 550, which was a little bit different, but we found that it was linked to obesity and anxiety and probably many more things that's just not been around as long to know what exactly the outcomes are. So then what did the industry do when we said, hey, that's not so good? Then they switched to phosphates, for which very little data is available. And what we know is that what we're finding is that it is also toxic. So we have this whack-a-mole game switching from one known bad actor to another unknown, soon-to-be bad actor. And you can X that guy out. And the gopher says, I don't go for this. Ha, ha, ha. Okay, next slide. I can't resist. This is another example of a regrettable substitution. And you don't have to be a chemist because I am not. But there's a chemical in a lot of products, decabromo-diphenyl ether. The only word you need to know is the ending ether. And it was found to be persistent and bioaccumulative and toxic also. So the industry switched because they were going to be, the EPA was going to take action otherwise. And so they switched to decabromo-diphenyl ethane. So you can just see the ending's a little bit different. And it's an ether, they have an ethane bond instead of an ether bond. Again, you don't need to understand that, but you can see they're very, very close. And what had happened? Yes, they're also PBTs, persistent bioaccumulative toxic. Next slide. I think that's back to you, Sarah.
Yeah, so with more than 80,000 chemicals mentioned and 1,000 or more chemicals coming on the market each year, there's just no way for EPA or scientists to assess each of these individual chemicals for their effects on human health and the environment. So we need some way to identify potentially harmful chemicals. And we want to thank Green Science Policy Institute for this visual representation of all the chemicals and how we might address them. So if we classify them into groups or classes, then it's a lot easier for us to be able to understand them and understand some of their problematic characteristics, because many of these chemicals that fall into the same class have the same characteristics and the same hazards. So CEH and many of our partner organizations are also particularly concerned with EDCs, or endocrine disrupting chemicals. People may think, when we think about chemicals and how they affect our health, a lot of times we might think of cancer, respiratory problems, heart disease, but EDCs kind of work a little bit differently, and they can contribute to a lot of the underlying causes of diseases. So because hormones are the building blocks of all of our body's functions, when chemicals start messing with those hormones, it affects our function and can lead to disease, and sometimes that can take many many years to develop, and so it can sometimes be hard to link EDCs to those negative health outcomes, but we really are trying to be very mindful of the effect that chemicals can have on our hormones and those long-term effects. Another important point is that EDCs, and particularly we know that PFAS, which is one of the classes of chemicals that are EDCs, can actually suppress our immune systems. And that can make us, while we're thinking about COVID-19 and the connection between chemicals and the pandemic, we know that a lot of these chemicals can both suppress our immune systems or can contribute to health conditions that might make us either more susceptible to COVID-19 or have a worse experience with COVID-19. So that's also something we want to be very mindful of. And we're not going to go in depth on all of the health concerns related to each of the chemicals of concern that are often found in conventional furniture, flooring, and carpet products. But here you can see the range of types of health concerns that can arise from the use of these chemicals. These chemicals can affect learning, especially in children. They, in fact, like we mentioned, affect our hormones, our reproductive health, our breathing and respiration, our immune systems, and many have been linked to a range of cancers. And we also know that the incidence of many diseases, including several types of cancers that have been linked to chemical exposure, are on the rise. Chemicals are generally transmitted a few different ways. They can be inhaled, ingested, and then also transmitted through our skin. Inhalation is pretty clear. We're not trying to ingest or take in these chemicals, but they're coming in through the air. They can also be on the food that we eat and drink, or on our hands when we touch our faces or when we're eating. And then also it's important to recognize that once these chemicals are in our bodies, they can cross the placenta or be transferred through breast milk. And then children who spend a lot of time, particularly on furniture or floors, have very frequent hand-to-mouth activity. So that's a very common route of exposure for kids. Another situation that many of us have been dealing with recently are fires, wildfires, and other types of fires. And so we want to recognize that there are a lot of occupational exposures to chemicals, firefighters and first responders, and then many of those who work in manufacturing and disposal or recycling of these products. So some firefighters are likely to be highly exposed to flame retardants, for instance, and have been found to have significantly elevated levels of different types of cancer, like multiple myeloma, non-Hodgkin's lymphoma, prostate and testicular cancer. And a recent study of San Francisco Bay Area women firefighters found that these women had 6 times higher rates of breast cancer than other women. So I'm going to turn it over to Jean now to start us off on the furniture component.
Great, thank you, Sarah. Hi. So we don't really have safe options, as you can imagine, for disposal of unwanted furniture, and other than landfill, and that's not considered safe. So we want you to consider extending the life of products. And Sarah, my screen might be frozen, but anyway, I'm hoping you can turn to the next slide. So we're asking you to, that wouldn't be the right slide. We're looking at no safe options. So I'm not sure what happened in here, but we're looking for at redeployment of furniture. And
I think actually, let's go, I think Judy's gonna talk a little bit, sorry about that, about the some of the chemical concerns, and then we're going to talk about the the disposal issues. Sorry
You're
about that.
correct. That's okay, no worries. Go ahead, Judy.
Okay, so now we're going to dive into some of what we call the hazardous handful. It's the 5 key chemicals of concern that are in furniture, and many of these are also in carpeting and flooring. We're not going to go into all of them because it would take all day. We'll go over them lightly, but you can see flame retardants, the fluorinated stain treatments or PFAS chemicals, antimicrobials, VOCs, and PVC. We're going to mostly focus on flame retardants, fluorinated stain treatments, and antimicrobials today. Next slide. So where are these found? So you can see, after looking for a while, probably that one of the largest sources of these chemicals of concern are in fabric. So you'll see pretty much you can have PVC fabric, fabric that emits VOCs, antimicrobial treated fabrics, etc., fluorinated stain treatments, and flame retardants can also be in fabric. So that's a very key decision point that you make. And you'll also notice that there are small parts that you may not think of. So when you add something to a piece of furniture, such as arms or some other edgings to a table, it can actually bring in the chemicals of concern. So you really have to be noticing the whole product. Next slide, please. So chemical flame retardants have been around since the mid-1970s, and they were required in furniture due to an outdated and ineffective flammability standard known as Technical Bulletin 117. But very, very luckily, in 2015, 2016, the state changed its regulations earlier, and then we were able to have furniture without flame retardants by the 2016 for sure. And you can see some of the health effects about flame retardants. I won't go into all of them, but I do want to point out that they migrate out of the products. So these are semi-volatile, meaning they don't stay put. And when you sit on your furniture or just with time, these chemicals migrate out and then they get in our dust. And from our dust, it can get into our bodies through the hand to mouth that Sarah talked about. It also gets in our pets and in the wildlife, and then they're out in the environment carried by air and water. And the sad thing about this for all those years is that we now know that they did not reduce either the severity of the fire or the number of fires. So we all carry that chemical burden for that history, and that's unfortunate. So what you can do is make sure you specify products that do not contain flame retardants and are labeled as such. So most products no longer contain flame retardants, very, very unlikely, but there is this label that you'll see on the screen for the new flammability standard, which is TB 117 2013. And ideally, you want to find the label under your chair or under a pillow in your couch that says, check, does not contain added flame retardant chemicals. So a fun thing you can do, either now or after the webinar, is look under your chair where you're sitting and see what it says. Next slide. Here are some other places where you'll find flame retardants. Building installation, we've already talked about some of these, so I'm just going to pass. Also wire and cable, and also electronics. Okay, next slide. So these are the PFAS chemicals. There was a professor who named them the forever chemicals, and I really like that name because it reflects how they are. They don't break down in the environment for very, very long periods of time. Some people say geologic ages, so that's a really long time. And they also can break down, when they do break down, they break down into problematic byproducts that are also toxic. So they're very, very accumulative. I mean, they are very persistent. And then when things are persistent, then they get into our bodies and they also get into the environment. And again, if they never go away, then as people buy more products with these chemicals and they're produced more, we just continue to get more and more exposed until we're continually saturated with these chemicals. So not a good thing. They do migrate, also these chemicals migrate out of products just like the flame retardants. And so they can be ingested in the same way through the hand-to-mouth activity. The good news is that there are many, many products that don't have these chemicals. You can ask for fabric that does not contain stain or water repellent treatments that contain these treatments. There are now some treatments that are water repellent or stain repellent that don't contain this carbon fluorine bond, the PFAS chemicals. Very few, but more and more probably will come on as the market requests more. But do be aware of claims of safer PFAS chemicals. We don't have a lot of time, but there's long chain chemicals and short chain. The long chain were found to be problematic. So many manufacturers said, okay, those are problematic, let's switch to the short chain. And now we're finding out that those are also problematic, maybe not quite as persistent, but they're uptaken very easily by the body, getting into our organs where they should not be, and plants can also uptake them, and then we actually eat them when we eat the food. So if somebody says it's safer, the only way it would be safer is if it doesn't have the fluorinated stain treatments in it. Next slide. Here are some of the common uses. It used to be very common in carpeting. Good news, Sarah will pass on about that. Also in cleaning products, you can see the furnishings and adhesives and sealants. Next slide. VOCs, most people think of this as like formaldehyde is really well known, and it causes, as you can see, respiratory problems as well as cancer. It affects our indoor air quality. So what you want to do is find products that meet either California Section 1350, that's how it's kind of known, although there's a more formal indoor air process, air testing, and the SCS Indoor Advantage Gold and Green Guard Gold. Just to know, SCS Indoor Advantage Gold may or may not equal Green Guard Gold. There's 3 levels that they have to meet, and SCS Indoor Advantage Gold requires 2 of those levels, but many products meet all 3. So you want to see the certificate to see which ones your products meet, and we can help you if needed. Next slide. Next slide, perfect. So a lot of people right now think antimicrobials are a really good thing because of COVID. You know, everybody wants to kill every microbe that there is, but the truth is some microbes are good and we need them for our body to digest and other things. So we don't want to do that. We want to use them when they're needed. And in furniture, I want to point out this wonderful, wonderful presentation or white paper that Ted Shetler did about antimicrobials and hospital furnishings, and the link is below, and you can Google it. We'll pass out the slides, you'll get them. But it really talks about all the science that's out there and where we're at. And there is very little evidence right now that there's any added benefit or that it reduces the spread of infection, which is why you would put it on a product. You want to reduce the spread of infection. So that's not what's happening. And then instead, again, these chemicals do come out and we can be exposed in the same ways of the other ways. And we're also very concerned, or the medical community is extremely concerned, that this could create superbugs, that by having these antimicrobials being put into everything, the microbes will become resistant, and then they won't be able to treat the common, or not the common, but the many, many things that do require antibiotics and things like that. So we suggest that you avoid products with antimicrobials. They're simply not needed. They are providing perhaps a false sense of security, and that's one thing I want to talk about. When people think their furniture has been treated, they're like maybe less careful with cleaning, and also and they have a false sense because it really doesn't work, and they tend not to get cleaned as much. And there was another point that just slipped. Understand marketing claims. So many things will say, kills germs or something like that. No, in order for a product to be effective, it needs to be going through a whole process through FIFRA. So we have a list of products that don't contain all of these things, so it will be very helpful for you. And just again, it does not reduce the spread of infection. And what's driving the market right now is actually purchasers asking for them in the hopes that it might produce some benefit. A lot of the manufacturers don't want to put them in. So purchasers, you're not getting the benefit, you're spending more money by asking for them, so you can pass. Next slide. PVC is just a problematic material throughout its life cycle. When it's produced through the manufacturing process, you're starting with some chemicals that are known carcinogens, or potentially human carcinogens. And through the manufacturing process, it can produce dioxins or furans, which are carcinogens. In the use phase, not all PVC has additives that are problematic, things to soften it, or other things. Flame retardants are often added to PVC fabrics. And at end of life, there's really no good way to dispose of these products, because if they're burned or in a fire, they produce those same dioxins and furans. And if you put them in a landfill, then these products can leach out the chemicals. So recommendation is that you avoid products with PVC. It's actually very easy to do. There's many, many options. There are some parts, you can see there's an exemption for less than 1% of the weight of the product, because some products are small, they just don't have replacements that aren't PVC yet. Maybe someday they will. Next slide. Jean, I think this is where I turn it over to you.
Great, thanks, Judy. Yes, it is. So I'm just going to speak a little bit to the fact that there really are no safe options for disposal of old furniture. So we would like you to consider thinking about the opportunities to extend product life when possible, and that can be done through redeployment. So furniture dealers and nonprofits can be great resources to reach out to in this regard if your client is not going to need their existing furniture and they're uninterested in and actually, reupholstering it or refurbishing it themselves. So that gets us to the point that reupholstery and refurbishment are great alternatives to landfill. And so as you can see in this image, these are some chairs that were just reupholstered recently by Kay Chesterfield in Oakland, California. And these chairs came from the San Francisco airport, and they're headed back to the airport for use. The chairs themselves were in great shape and really just needed reupholstery. And there's a lot of opportunities in terms of even beyond keeping furniture out of landfill. We can see opportunities or benefits such as saving energy, avoiding the outright landfill, or using waste energy, which can really present with communities with very toxic air quality. We can reduce the carbon footprint for our project, for our clients, for our world. It can save on our resources for sure. And as in San Francisco, one of their goals is working towards achieving a zero waste reduction goal. And so furniture reuse definitely helps that. And there are many other cities that are adopting this zero waste goal nationwide. Next slide. So I'm sure you're very familiar with the fact that we've got a lot of Ecolabels and standards out in the market, and they continue to expand. And so we wanted to just help you understand some of them at least. So there are single attribute Ecolabels that you see on the right side of the slide, and they could be something that just addresses indoor air quality or just addresses recycled content or the sustainability of the wood. Whereas the Ecolabels that you see on the left have multi-attribute criteria, and they address a multitude of sustainability issues, including some of what I spoke of from the single attributes and additional ones. An HPD or Health Product Declaration, for example, provides not only transparency, and third-party certified HPDs are now available, but they will also help you understand all of the different certifications that the product has met, whether the item is LEED compliant and will help contribute towards LEED or towards WELL or other rating systems, that it will identify whether the product meets VOC requirements or not. And similar to an HPD, a declare label can also provide you with a variety of information. Is it free of red list chemicals? Where was it finally assembled? What's its life expectancy or end of life options? So we highly recommend that even though the single attribute certifications can be very helpful, if you go to an HPD, you're not only going to get transparency, but you will also be able to have access to all these single attributes. Cradle to Cradle is also a credible label, but they're not actually transparent. And so if you're looking to try to avoid specific chemicals, you're going to not only either have to dig into Cradle to Cradle's methodology, or you're going to have to ask the manufacturer for that specific data that you're looking for. But do understand that a Cradle to Cradle label does come with a commitment to improving the product over time and holistically. Otherwise, they have to drop out of the Cradle to Cradle program. Textiles are a little bit late to joining this game because textiles have really struggled to even stay in the market in the US. But currently we are seeing fabrics references that have met Cradle to Cradle and have recycled content, and the FACS NFS ANSI 336 is the standard for certifying sustainable textiles. Next, please. So we have there are a number of resources for you in the market today that will help you be able to research this the data that I've just been speaking to and the certifications, one of them that we like to point out is Mindful Materials. It lives on the GIGA platform, and it's a free platform for designers, architects, and for owners to use. It has aggregated information on human and environmental health impacts from products. It has your certification data, and all of this information has been uploaded by the manufacturers, and it's their responsibility to keep it up to date. But there is a large group of people that are very committed to reviewing what is uploaded and approving manufacturers to have a minimal amount of sustainable data to even be in this site. So it is a great site to use. And more recently, a new product has been developed on the GIGA platform called Matter. And it's a material management platform. So if you have a project or you have standards that you expect people to use for all of your buildings, this can be a great place to store that data and for designers, contractors, and others to use to access that information. You're able to get the data from Mindful Materials or from another platform called Origin, and be able to collect all of that data. And the other thing that Matter will allow you to do is to develop a library and to curate that library for all of your staff to use. And the product can show up as approved, as you see here on the slide, or in review. Next, please. So the ANSI BIFMA E3 Furniture Sustainability Standard was developed many years ago by a number of stakeholders, including CEH and Healthcare Without Harm, and using a consensus process that's been approved by ANSI. Having been an advisor and reviewer for close to 20 years now, I can definitely testify to the variety of stakeholders and the true consensus process developed. So one of the newest credits, 7.4.4, now addresses the hazardous handful of chemicals that you've heard discussed today. CEH and Healthcare Without Harm worked very closely with BIFMA to develop this criteria, which provides you with a shortcut so that when you're looking for third-party certification that the products avoid the hazardous handful, this is what you can ask manufacturers to confirm that they've met. Next, please. There's a number of building certifications, and you may be wondering, can our furniture actually contribute to that certification? And the answer is yes. Lead for Healthcare has had a furniture credit from the get-go, which I actually worked on the development of, so I'm very familiar with it. What's really exciting is that there is now a greatly improved credit that's in the version 4.1, and excuse me, so you can see that listed here. Another way your furniture can contribute towards a building certification program is version 2. Version 2 was just newly launched, and it's accessible in the market. And so there's XO5 and XO8, both which are looking for restricting the chemicals that we've been talking about, and additionally other chemicals as well. So your furniture can definitely contribute with and finally also with the Living Building Challenge. Version 4.0 was also relatively newly launched, and so there's imperative 12 and 13 for responsible materials and red list, as well as the LBC's version 4.0 material pedal. Next, please. And at this point, I'm going to pass it back to Judy. Thank you.
Hi, everybody. I know we've got a lot of information here, so I hope you're hanging in with all of us. This is a tool, excuse me, that CEH developed to help purchasers find safer products. So it's another way to do it. It's a Google form, so you can search by the manufacturer, the type of product, the product name, and sort and filter. And this can be used to help your staff find out what products you want them to buy. So if you just hand them this list and say, if it's however your products work, you could buy anything from this manufacturer on this list, and then it's all good to go. I do want to say, if there are government purchasers on the line, that NASPO, which is a group purchasing organization, there is a contract for furniture, and I think there's 3 or 4 manufacturers on there, and that just tells you of their products, how many are on that contract. And you can buy through the state if your state's already buying. If you're a city or local government, you can also buy through NASPO for those products as well. Next slide. So here's a partial list of manufacturers that are free of the hazardous handful, and it is literally only a partial list. Healthier hospitals, which is part of Practice Green Health, and Health Without Harm also have a full listing. So this is just designed to show you, it's not like you're going to have to just pick from a very few small unknown manufacturers. These are probably most of the manufacturers that you work with already. And again, this is only a partial list. Next slide. So we're very proud of our purchaser pledge. We started a few years ago, and we are asking purchasers to commit to preferring products that meet the specifications that don't contain the hazardous handful. And the reason that this is so important is that manufacturers want to make products that you want to buy. So if you commit to preferring those products, then manufacturers have an incentive to do this work. And you'll see we have some wonderful purchasers on there, including HDR, where Jean works. I'm really proud of the University of California system because they just signed on. They're our newest signer, and it refers to all 10 campuses. So this will protect about 500,000 people, the staff, the visitors, and the students. And you can see we have people from higher ed, government, private businesses, healthcare, etc. So if your organization's name is not on here, you don't have to be sad. We can make more room. So please let us know, and we'll work with you on how to do that. Next slide. I also want to share with you sort of breaking news, which is that GreenScreen now has a certification, yes, one more, for furniture and fabrics. Kaiser Permanente has their own specifications, and this will comply with Kaiser's standard, which does go beyond the hazardous handful. So it definitely restricts all the chemicals we talked about, as well as additional ones that can be problematic. They have 3 levels, as you'll see, bronze, silver, gold. And they also have more transparency requirements, and you can get a higher rating if you're more transparent. They are doing a webinar on October 28th, which we want to promote, so there's the link. And again, you will get this PowerPoint, and you'll be able to sign up for that, hopefully. Next slide. Okay, now I'm going to turn over back to Sarah.
Thanks, Judy. As you've heard in this presentation, CEH has worked very closely with Healthcare Without Harm in our furniture work, and building on that successful collaboration, we also teamed up again with Healthcare Without Harm to take on our newest product categories, which are carpet and resilient flooring. And these are products that are used in commercial and contract settings. So we're using the same criteria that Healthcare Without Harm developed and the same list of compliant products. And we'll talk about a little bit about that in a minute. So why should purchasers focus on carpet and flooring within your sustainability efforts? One reason is that first of all, carpet and flooring is a very high volume products. They're used everywhere. And sometimes they can also be high turnover products. So depending on wear and tear, and if the right product is used in the right spot, we know that some facilities or buildings are replacing their flooring and carpet pretty frequently. So this can be a major source of waste. And if those products contain toxic chemicals, then those are going into the waste stream. And we also know that those chemicals can then leach from landfills into our groundwater. Traditionally or historically, carpet and flooring have also been significant sources of chemicals of concern. We know, luckily, that's changing. And with your purchasing power, it can change even more. There's also an issue about the opportunity for exposure to the chemicals in these products across the life cycle. Like Judy mentioned we mentioned earlier, how people involved in manufacturing and disposal can be affected. Also, communities where these products are made can be affected by the chemicals that are disposed of or discharged in their local area. And then again, when the products people are done using them, we have to think about where that goes. They also, also the products themselves, as well as the maintenance of the products, can impact our indoor air quality and our health. So we've already talked a little bit about that. So it's just really important that with such a large product in our space, or such a large volume of it, that we want to make sure that it's safe and isn't going to compromise our health. So in looking at the certifications and standards for carpet and flooring, Healthcare Without Harm really took the lead on doing this assessment, and basically looked at a range of existing third-party certifications, product declarations, and consulted with green building professionals, architects, designers, and scientists, and sort of came to the conclusion that none of the existing standards addressed all of the chemicals of concern. And so, and as Jean pointed out earlier, some are, like with furniture, some standards are single attribute, some are multi-attribute. And either way, it was hard to identify one that was widely used and that covered everything that we were concerned about. Healthcare Without Harm also held several rounds of conversations with manufacturers in order to understand the product categories more generally and the range of safer alternatives available. So we're really excited that just a couple months ago, or last month, Healthcare Without Harm and its sister agency, Practice Green Health, launched Green Health Approved. And so this is a new seal that helps to identify products, carpet and flooring products that meet the criteria that Healthcare Without Harm developed and that CEH has adopted and is promoting. So now it's easier to identify these products because they'll have this seal. And I just wanted to say that if you've been on one of our webinars before, have used our materials or Healthcare Without Harm to select products, there's no difference in the Green Health Approved criteria from those flooring and carpet criteria that were previously developed just a couple of years ago. So there's no change in that regard. All of the flooring products that we had previously listed are still now have this seal. And then for carpet, we're still awaiting registration of products that'll have the seal. There have been some delays due to COVID, but we're hopeful that we'll have a listing of products, carpet products that meet Green Health Approved in the next few months, hopefully. And we're still, in the meantime, recommending that you can either put the criteria or Green Health Approved in your specs or RFPs, and you can also look at the San Francisco approved list of carpet products because their criteria and ours are very similar. Just to talk a little bit about how the program works, it's an industry-wide healthcare utility that can be used by anyone who sources products. And I just want to say that, you know, a lot of times people hear Green Health Approved or Healthcare Without Harm and think, oh, these products are specific to the healthcare sector, and that's not really the case. While some of the products might be particularly useful in clinical settings, these products can be used in healthcare and non-healthcare settings. A lot of them are used in all types of contract settings. So again, the program leverages the human and environmental health work of the agencies that developed it, and products that carry the Green Health Approved seal have been reviewed and verified to meet criteria developed by those agencies. And if you want more specific information on Healthcare Approved, you can visit www.healthcareapproved.org. In terms of the product scope of the criteria for resilient flooring, the criteria apply to all resilient flooring except fluid applied polymers, polymer floors, and concrete, and they also exclude floor leveling compounds. And for carpet, it's all carpet tile, broadloom carpet, and the padding and every component of the carpet, the criteria applies to. Area rugs, outdoor carpets, and rugs are excluded. So as Judy mentioned, the hazardous handful, we see those here and many other chemicals and materials of concern. So the criteria cover the restrictions and have requirements for all of the items that you see listed. For flooring and carpet, for both flooring and carpet, the items in black apply to both, and then the ones in blue are specific to carpet. So you'll see things like styrene, butadiene, rubber, fly ash, and some requirements around face fiber and recycled materials and dyes and pigments. So you can find all of the restrictions and requirements in our specs and in the criteria documents. Manufacturers who have Green Health approved products for resilient flooring are the ones that you see on your screen. Hopefully they're familiar to you if you're a buyer. It's a great range of products, and we're hopeful that we'll also have a number of manufacturers who comply with Green Health approved for carpet. In our resources, we have modeled technical specifications for both carpet and resilient flooring. And as Judy showed the furniture buying guide, we also have a flooring purchasing guide for resilient flooring, and we'll be adding carpet as soon as we have that information. We can also, of course, help you to use these tools or provide additional technical assistance. And I'm going to turn it now over to Jean to talk about certifications.
Thank you, Sarah. So similar to what I had mentioned earlier, very similar to what I mentioned earlier in regards to furniture contributing to a building certification program, we have the same certifications here that will, except for LEED for healthcare, because they just have when it comes to avoiding chemicals of concern, they just have a furniture related credit. So here again, you've got WELL version 2, which literally just rolled out in the last month or two after a long pilot phase. We've got the Living Building Challenge version 4, which was rolled out earlier this year, in the Living Building Challenge, or LBC version 4, material petal. So you've definitely got ways that your flooring choices can contribute towards a building certification program. Next slide, please. Another really key element to consider, even when it's at that point in time that you are just considering what products you're going to use, we need to take maintenance into consideration. Because, and one of the key elements when it comes to resilient flooring is the stripping and waxing issues, because they do contribute to respiratory issues for workers and for staff, and as well as patients if it's a healthcare facility. So when you're looking at products, definitely consider the wax-free products. And another way to take into consideration having a successful project in the whether it's a remodel or a new building is to really look at the flooring product adjacency. So if you're specifying more than one product, what is it going to be adjacent to, and can they be cleaned in the exact same manner, really? Because this maintenance staff typically do not have a lot of different tools that they use and a lot of different products that they use. They use a couple of them. So definitely take into the adjacencies of different products to each other to make sure you're going to have a successful project in which they can be cleaned in the same or very, very similar manner. And also, when you're looking at products to specify, confirm in advance that they actually do offer green cleaning protocols. Next, please. So we have a case study project I'll just share a couple of thoughts about for the Children's Hospital in Oakland, California. That's part of UCSF Benioff. We had an emergency department, or they had an emergency department, and they had tried a couple of different flooring types. The second one was linoleum, and we were not involved at this time whatsoever, but they had chosen to wax it. And the waxing and stripping was actually sending nurses home during their shifts. And you can imagine how challenging that would be if you had nurses going home in the middle of a shift. So as I mentioned earlier, the stripping of wax can actually trigger respiratory illness or asthma. So it's important to really seriously think about which flooring products are going to eliminate triggering health issues. And in this case, for this project, Nora Rubber Flooring offered them a solution, because it did not need to be waxed. It could be buffed. and they had a green cleaning protocol. They have a really green cleaning protocol in place that can be used. So thank you. I'm going to turn it back over, I believe, to Sarah.
It's actually going to be Judy.
Oh, thank you.
So
Yes.
thank you all. I really want to
Thank you.
empower you, because wherever you work, your organization can make a difference. And as we talked about, purchasers and specifiers really move the market, because you're the customers, they want to please you. And it moves faster than regulations or legislation, which can take many, many years. So that's how we get things moving, through your purchasing power, combined all in the same direction. Okay, next slide. CEH has a lot of resources for you. You can see them right there. I won't go over all of them, but we really want to make it easy for you. We want to make this low-hanging fruit. So we've already developed the tools you need to deal with furniture, flooring, and carpeting. So if you're looking for a sustainability project, but you don't have all the time, CEH can really help shortcut that through these services. I will just highlight, for example, we can survey manufacturers who've not been surveyed. We can do product testing if you're concerned that your product contains some of these chemicals of concern. And we also now offer some customized consulting and technical assistance for those of you who want some more individualized help. Next slide. Oh boy, this is a big one. I know we're almost out of time. So here's some tips for purchasers. Ideally, you would identify these healthier products like Jean was talking about with the Matter tool, where you can just pick what you want, or through the CEH listing or other ways, and then block the non-EPP products. If you can do that, that's the best way to ensure you get compliance. If you're in a contract extension, so you have maybe one more year with somebody, you can use that time to say to them, you know, we'd love to renew with you, but we would need to see more products that comply with whatever it is that you're wanting. And you can actually do that mid-contract too, and have a discussion with them. You know, if you're working with a supplier who currently doesn't conform, you can give them time to say, you know, we understand you need to go through this BISMA process to get certified to 7.4.4, or through Green Health approved, or through GreenScreen certified. You know, we're okay with that, knowing that you're moving, but in 2 years or 1 year, whatever the time frame is, we're going to be requiring that. You may be willing to need to switch suppliers if you can't get what you need. And the last other general tip is you can piggyback on existing green buying agreements. So if a state, for example, we were talking about, has a good contract, you can buy off of that. So kind of in closing up, our product specific tips: ask your manufacturer to apply for Green Health approved, and then put that in your specifications, your RFPs, and your contracts. And that's how we'll make the market know what we want. For furniture, you can put our specifications in the RFPs. You can request furniture that meets the BIFMA 7.4.4 criteria, or now you can request products that meet either the Healthy Interiors, which is a Healthier Hospitals program, or GreenScreen certified. So we're so lucky to have so many good options. These did not exist even a year ago, many of them. Next slide. So next steps, what should you do? Share this information with whoever in your organization has the power to sort of make things happen on this issue. And then call us and let us talk about next steps with you. And then you're on your way. Next slide. This is just a list of resources we'll have available for you. They're great. And next slide. So this is cute. We're all in our own little toxic cloud, but we don't have to be, because when you take these chemicals out of the products, the levels go down in your dust and in your body. So it's really a great thing. We don't have to be pigpen all the time. Next slide. And this is our contact information, and we'd love for you to contact us with any questions. I know we have some questions already, and if you have others, we'll try and take as many as we can. And if we don't get to you, let us know, and we can contact you after the webinar. Okay, Sarah, I'm going to turn it over to you.
Great. I'm just looking in the Q&A box, and I know that we're at time, so if folks need to go, we understand, and if you want to stick around, that's great too. So we have, we'll try to go, we just have a few questions in the Q&A box. One is, what year, oh, Judy, this is like a trivia question. What year did flame retardants and chemicals start being used on fabric so heavily?
Such a good question. It all started in the mid-1970s when this old standard, the technical bulleted standard, required that products meet this small open flame test. And that's, by the 80s, it was more. So if you have a really old piece of furniture before 1980, it's probably not treated with these chemicals, but starting then, they probably were. I just want to say, can I add to that? One of the reasons we tried to go so fast, because we normally don't combine furniture and flooring together, but we wanted to give you both. The reason it changed was there was a change in the regulation so that instead of a small open flame test that only dealt with, did not reflect the reality because it was a test on bare foam and we all sit on fabric before the foam. Now we have a new test, and the new test checks for the major source of fire, which is smoldering cigarettes and things like that, and can be met without the use of flame retardants, and that's why we've gotten rid of them. Okay.
Great. Thanks, Judy. We have another question. Any plans for a pricing study for alternatives, especially for resilient? That's a great question. I would love to do that. We know that luckily at this point, the healthier furniture options are cost neutral. They're not more expensive than the ones that have the chemicals in them. Right now for resilient flooring, that's not the case. A lot of the healthier resilient flooring products are more expensive than some of the alternatives, the conventional alternatives, especially those that are primarily vinyl. So we'd love to do a study or look at cost and how we could potentially bring down the costs of some of the newer, safer products. And also looking at things like total cost of ownership, which doesn't look just at direct costs, but also looks at the cost over time of having some of these products and also the other sort of environmental benefits of the safer products. So we would love to work with others who are interested in exploring some of those issues. Jean or Judy, do you have anything to add to that?
I would just like to ask Mikhail if he's would be interested in working with us on that. There have been some really great pricing studies over the years, but nothing, I definitely am not aware of anything current. And but it would be fabulous and a great resource for people if we had something current.
Yeah.
The total cost of ownership, as Sarah said, is not just the initial purchase price, but if you're having a wax and strip, that should be factored in. Longevity needs to be factored in, all those good things.
Yeah, and even if it isn't wax and strip, what is that maintenance cost and what is that overall, how does that add? Because like back in the days, VCT was always touted as being the least expensive flooring, but if you look at total ownership, it's extremely expensive because you should never walk on VCT. You should be walking on the finish that goes onto it.
I noticed one person wrote, "Oh no, antimicrobial masks are being touted now." That's true, as is antimicrobial underwear, socks. Silver is used, often nano silver, and you might see it because it'll say, odor resistant, and that's kind of a big hint that it probably is treated with antimicrobials. So I would suggest you stay clear of those. Great.
Those are all the questions we had in the box. The others were related to the survey issue, the polling issues that we had at the beginning. We do have a post-webinar survey. Should pop up. The link should pop up when you leave the webinar, and we would love it if you could take that survey. It really helps inform our future work and our future educational efforts. Anything else before we close?
I just want to thank everybody for coming, and we're so appreciative, and you are part of a bigger group that's moving the market towards healthier products, which is fantastic. So thank you so much. So somebody asked if we could go back up to the slide with the website addresses on it, but will that get in the way of the post survey? Because you will be getting these slides. Okay.
This one?
Yeah. But everybody will get these slides. So. Okay, thank you very much. And Sarah, you're sending out the post survey. Perfect.
Yep, and then there's a quick note here from Tressa at with Green Health Approved that says she just wanted to clarify that not all suppliers on the flooring list have applied for the seal at this time. The list will be available through January 1st. We are working to bring all under the new Green Health approved seal. So they all qualify, but they don't all necessarily have the seal yet, I think is what Tressa is saying.
Great. Thank you, everybody, for being here. We really appreciate it.
Great. Thank you. Thanks, Jean. Thanks, Judy.
Thank you, Jean.
Thank you.